healthcare reform. One is disability and the safety net. I have a daughter who is about to be 18, who's significantly disabled and should be dependent on her father and I for her whole life. And so that was part of how I got into trying to find out about public policy. Was I wanted to know what the safety net was, because statistically she'll outlive us. She's actually pretty healthy even though she's disabled. And so one of the areas in disability that I'm really interested in is how we can redesign the system so that it's not so administratively heavy. You know, in the med health system, depending on who you believe, we spend 20 to 35% of our medical dollar on administrative overhead. In the disability system, I've heard that it's closer to 50%. And I had actually this dad come up to me the other day at a neighborhood meeting who said that he had a son who was disabled, and before his son was on Medicaid, they'd pay about $1,500 a month for somebody to come in and get him ready for school every day. And then his son got onto Medicaid, and because of they had to have a nurse who did this, a so-and-so who did that, they were spending $3,500 a month. And he said, you know, this is obviously one way in which you could have the same dollars cover more people. So one of my ideas in that area has been to see if we could get a foundation to give us a grant to bring in sort of like either a Six Sigma or a Toyota Lean kind of person to go through our system and tell us where our waste is at. I think it's a balance, because people always want to be sure that the system isn't being gamed, that services are going to appropriate people, and any time the state puts their funding behind it, that there's a certain quality of the service so you don't get sued for, you know, negligent care. But I think it's tilted way too far into being administratively heavy, and I'd like us to figure out how to do it a different way. There's a program in Medicaid actually called Consumer-Directed Attendant Support, where people who are cognitively able can sort of hire and fire their own care attendants and get more of that overhead directly into their own care, and so that may be a model on which to build. So I do think a lot about long-term care in our state, not only for my daughter, but because the other trend you may hear about in the news, especially if you join AARP, is that we're going to be having a big boom in baby boomers aging. And people are just living longer than they ever did before. I forgot the number for how many centenarians there are now, but enough that they actually, Hallmark is making a birthday card for happy 100th birthday now. You know? So I also sit on a governor's committee called the Community Living Advisory Group, and we're supposed to be looking at how do we make it so that people can age safely in their homes as long as possible. Most people don't want to end up in a nursing home. But sometimes our systems don't allow us to efficiently provide for people in their homes. So because of the rise in baby boomers, we're trying to look at how do we redesign or provide supports in the community to empower communities on their own to have the supports they need to keep people aging at home as long as possible. The other area of interest for me is the education gap amongst people, I think more in poverty even than racial and ethnic minorities, but both tend to have an education gap. And so I'm active with a committee with Denver Public Schools, looking at how do you get more parent engagement in education amongst people who live in poverty, and get them more excited and even just in some cases knowing what to do. So those are the main areas I'm looking at. I'd love to, because I could ramble for as long as you wanted me to, but I'd love to hear what things are on your minds.
Just a heartwarming story. You told us once that you have two daughters, and you took them both to Cleo Parker Robinson dance, and Cleo figured out a way to get her disabled to participate.
Yeah. Actually, the woman who used to play Granny all the time, Marjorie, was just wonderful with Amy. And they were always very warm and accepting of her. You know, you mentioned that makes me remember one of our most memorable trips was my husband is pulmonary and critical care medicine, so I always tell people he's my sugar daddy. So when our kids were young, we were able to go to Indonesia. We went to the island of Bali with the 3 children. And what was so beautiful about Bali was that Amy, they don't see many people survive with disabilities, so my daughter who was disabled, people would come up to us and say, can we touch her? Because they felt like she was blessed by the gods. I mean, it was just so moving, you know, it was just lovely to be there and see that reverence of people who are living with disabilities. I thought what a nice culture that was, so maybe I'll have to retire to Bala.
This is an aside, but I've tutored for 9 years through DPS and KIP. It's Knowledge is Power program. And they're 97% Latino, 97% qualify for a free and reduced price lunch. And now they're working on 90% going to college. But I also mentored another kid who's undocumented, and I got onto the Infinite Campus. Parents can get onto the Infinite Campus, but his parents couldn't read English anyway, so I asked them if I could do that, and they did, and I got on 1 month, and he had missed 14 days of school. I mean, that's 20 to 24 days of school a month. So I went to the truant officer at North, and I said, shouldn't somebody be visiting the home? And she said, oh no, he's better than most of the kids. And then I went to KIP another time. Well, no, I was tutoring in a GED program, and I realized that this woman had a 4th grader, and I said, why don't you apply to KIP? She said, oh no, I won't have him go there because if you miss 1 day, they call you. You know, it's just part of the problem, I think, with the achievement gap.
I do think that, there's this quote by Goethe that said something like, treat people as if they were what you want them to be, and you help them become what they're capable of being. And I think in some ways, in reverse, that happens a lot of times is that schools begin to get this attitude of, oh yeah, they miss all the time, like that's the new norm and that's okay. Instead of sort of raising the expectation and saying they may miss all the time, but that's not okay, and how are we going to change this? And I actually have had the chance to visit West Denver Preparatory School a couple of times, and similar to KIP, it tries to increase the expectations and standards on the parents and the children as well. And I don't know how many of you are active in the Democratic Party of Denver, but there's a little bit of a tension there between people who support charter schools and school reform and people who feel like we should just be making our neighborhood schools better. And I'm always sort of torn as to where I am, because I'm never just, you can't just be black or white. And one of my concerns only with charter schools and these excellent schools is that they haven't sort of figured out how do kids with disability fit into this picture. And obviously being the mother of a child who's disabled, I think that's important. At the same time, hearing that 90% of kids who are on free lunches are going on to college is so heartwarming that you hate to say, no, you can't do that. And so I'm sort of excited to hear that West Denver Prep is starting a disability program at one of their schools. And I was they just renamed to Strive Preparatory Academy. And Chris Gibbons, who's the founder of those schools, was there, and his mom and brother were there, and his brother is a young adult with Down syndrome. And I thought, oh good, he at least has some perspective on which to build in trying to do this. So I told him I would be curious to see how they did this, because I think, I don't know about you, but when I was growing up, I never saw kids with disabilities, nor did my husband. And so when our daughter we found out she would be disabled, we were really sort of freaked out, because we just didn't know what the lives of people with disabilities were like. And so I think my daughter has always been able to be included in a school. She goes to Jefferson County Open School. And I think what's nice is just the comfort those children have with people who are different, because they've seen them all their lives. It's just a whole different. So I think there are pluses and minuses to both, but like I said, I love the change in achievement that's happening, but I think we need to step back and say, okay, how are we taking care of everybody, not just the achievers?
Questions from